Good day, students, and welcome to our PE class. Our topic for today is first aid. For this lesson, our objectives are the following. First, define first aid. Second one, identify the common injuries that may happen during sports officiating activity. And third, familiarize yourself with the methods on first aid. Now, what is first aid? First aid is an immediate and temporary care given to a person who has been injured or suddenly taken ill. For minor conditions, first aid care may be enough. For serious problems, first aid care should be continued until more advanced care becomes available. The decision to act appropriately with first aid can mean the difference between life and death. Let's go now to the objectives of first aid. First aid is done to alleviate suffering, to prevent added or further injury or danger, and of course to prolong life. Let's go now to the importance of first aid. Actually, the importance of first aid is difficult to overestimate. Among the major benefits of first aid are the following. First, providing quick medical treatment until professional assistance arrives. Second, first aid helps ensure that the right methods of administering medical assistance are provided. Third, knowledge in first aid also benefits the individuals themselves. And fourth, it affords people with the ability to provide help during various emergency situations. Since we are in MAPE 9, our main focus is on officiating officials and athletes on indoors and outdoors activities. Now, let's identify the common injuries encountered by officiating officials and athletes. The first one is sprain. Sprain is caused by torn fibers in a ligament. What are ligaments? These are tissues that connect bones at a joint. Falling, twisting, or getting hit can all cause a sprain. Swelling and bruising are some signs and symptoms of this. Next one is a strain. A strain is when a muscle is stretched too much and tears. This is also called a pulled muscle. It is a painful injury and it can be caused by an accident, overusing a muscle, or even using a muscle in the wrong way. Now, what do you think is the difference between sprain and strain? The difference between a sprain and a strain is that a sprain injures the bands of tissue that connect two bones together, while a strain involves an injury to a muscle or to the band of tissue that attaches a muscle to a bone. Next injury is the knee injury. Actually, this is the most common injury encountered by officiating officials and athletes, and these include fractures around the knee, dislocation, and even sprain. Next one is fracture. A fracture is a break in the bone that can occur from either a quick one-time injury to the bone or from repeated stress to the bone over time. Fractures commonly happen because of car accidents, falls, or sports injuries. Other causes are low bone density and osteoporosis, which cause weakening of the bones. And the most common symptom of a stress fracture is pain at the site that worsens with weight-bearing activities. Tenderness and swelling often accompany the pain. This is very important for the coaches to recognize and refer the athlete to the trainers or the team physicians. And last one is dislocation. When the two bones that come together to form a joint become separated, the joint is described as being dislocated. Contact sports such as football, basketball, as well as high-impact sports that can result in excessive stretch or falling, cause the majority of dislocations. A dislocated joint is an emergency situation that requires medical treatments. When you are playing sports, accidents cannot be avoided. This is why you should learn how to do first aid just in case you have encountered people experiencing injuries. Minor injuries such as mild sprains and strains can often be initially treated at home using PRICE or PRICE therapy for 2 or 3 days. Experts recommended acute injury patients use PRICE shortly after the injury occurs. These may be particularly helpful during the first 24 to 72 hours. Now, let's go now to the first method. Actually, this method before was called RICE or RICE, but they said that P is important or protection is important. Let's go now to the P or protect. Protect the affected area from further injury. For example, by using a support. This is very important to the healing process. An injured leg or foot may be protected by limiting or avoiding weight bearing through the use of crutches, a cane, or hiking poles. Particularly, immobilizing the injured area by using a sling, splint, or brace may also be a means of protection. R. Rest. Rest is very important to allow healing. Many sports medicine specialists use the term relative rest, meaning rest that allows for healing but is not so restrictive that recovery is compromised or slowed. Avoid exercise and reduce your daily physical activity. Using crutches or a walking stick may help if you can't put weight on your ankle or knee. Next is I for ice. Ice refers to the use of cold treatments, also known as cryotherapy, to treat acute injuries. Ice is recommended with the intent to minimize and reduce swelling as well as to decrease pain. C or compress. Compression uses elastic compression bandages during the day to limit swelling. This compression minimizes swelling and provides mild support. Applying an elastic bandage does require some attention to detail. It should be applied directly to the skin by starting a few inches below the injury and wrapping in a figure 8 or spiraling manner to a few inches above the injured area. Next is E. Elevate. Elevate is recommended to help reduce the pooling of fluid in the injured extremity or joint. Controlling swelling can help decrease pain and may limit the loss of range of motion, possibly speeding up recovery time. Let's go now to the next method. The next method is called HARM. HARM stands for heat, alcohol, running, and massage. H is for heat. Heat will cause blood vessels to dilate, which in turn will increase the flow of blood to the area. Avoid hot baths, showers, heat packs, and heat rubs. A is for alcohol. Similar to heat, alcohol has an effect of dilating blood vessels, which in turn will increase the flow of blood to the area. Alcohol can also mask pain and the severity of the injury, which may put you at greater risk for re-injury. Avoid drinking alcohol in the initial stages of healing any injury. Next is running. An increase in heart rate increases the flow of blood around the body. This will cause blood to accumulate in the area faster. Take the opportunity to rest. Next one is massage. Massaging the area once again will stimulate the flow of blood to the area. Avoid massage in the initial stages of injury. And that ends our lesson for today. Always remember this before you give a first aid. Remember to first check and make sure the environment is safe before you approach the victim. And of course, do not forget to introduce yourself to the victim and ask permission to help. Then, determine the problem so you would also know what type of help is needed. Thank you for listening and God bless you all.